What we're going to do now is think about the mechanisms of venous return. Now, it's fairly obvious that blood can get pumped to the feet or up to the head because in the arteries you have a blood pressure that pumps it there. But how does blood get back from your toes back up to your heart ready to be pumped out again? Now, it's important to understand this because it can go wrong in various ways and give rise to some pathologies. But for now, let's restrict ourselves to thinking about the normal function, and we're talking about the mechanisms of venous return, how blood gets back from the periphery back up to the heart to be pumped out again. So how does the blood get back to the heart? Well, the first one I want to mention is the fact that veins have valves. Veins have valves. Now, a valve is a structure which will ensure a one-way flow of blood. And the valves in the veins ensure that the blood can flow from the periphery back to the centre. So if we think about a vein in the leg, for example, this might be the vein, and it contains valves. And the valves point up the way like this. So in other words, they will let blood go from underneath to on top, but then when the blood tries to go from on top back down again, well, the valve stops it. So the valves in the veins will be doing this, letting blood go from the periphery to the centre, but not from the centre back to the periphery. So the valves will be pointing up in this direction like this. It's a bit like a ladder, really. So if the blood is able to get from here to here, this valve will close and stop the blood flowing back again. Then it can get from there to there, and there to there, and so on. So there is a ladder, sort of a ladder that the blood can climb up. So veins have valves. Next point I want to mention is it's related to blood velocity. Now, what do we mean by blood velocity? Well, if blood is going from a wider vessel into a more narrow vessel, what will happen to the speed of the blood? Well, if it's being forced from a wide vessel into a narrower vessel, the rate of blood flow is going to increase. The speed or the velocity of the blood will increase. And it's the same in the veins. If you take all of the small veins and add together their lumens, you actually get quite a wide lumen. But as it comes back towards the heart, so we have several veins here with a particular lumen, and as it gets back towards the heart, the vein is wide, of course, as it gets back towards the heart, but if you add that lumen up, and that lumen up, and that lumen up, collectively they're going to be much greater than that lumen there. So as the blood goes into vessels with a relatively smaller total lumen, the blood velocity will increase, and that will help the blood get back to the heart as well. So again, remember the blood is flowing up in this direction like this. So the velocity of the blood will tend to increase as it gets back towards the heart. Now, another factor in venous return is pressure changes set up during respiration. So let's think about this one. So if you put your hand on your tummy and you breathe in, which way does your hand go? Well, when you put your hand on your tummy and breathe in, your hand will go out, because what is happening is that the diaphragm moves down. Now we can see this fairly clearly on this model. Here we have the abdominal cavity, here we have the thoracic cavity, and here we have the diaphragm. Now when you want to breathe in, the diaphragm goes down and the ribs go up and out. Now because the diaphragm is going down, it's increasing the pressure on the contents of the abdominal cavity. And here, running through the abdominal cavity, we have this large vein here, very large vein. What's this vein called? Well, this is the inferior vena cava, bringing blood back from the lower parts of the body, through the abdomen, back up towards the right atria. So as the diaphragm goes down, that's going to compress to a degree the contents of the abdomen, and that's going to compress the inferior vena cava. Now the valves in the veins will stop the blood being pushed down to the feet, so that will tend to help the blood go back up towards the heart in the thoracic cavity. In addition, when you breathe in, the diaphragm goes down, the ribs go up and out. Now when that happens, what effect will that have on the pressure in the thoracic cavity? So the diaphragm's gone down, the ribs have gone up and out. What happens to intrathoracic pressure? Well, because the volume has been increased, the pressure will be decreased. There is a decrease in pressure. And that decrease in pressure tends to suck air into it does suck air into the thoracic cavity, of course, through the trachea, but it also tends to suck blood back into the thoracic cavity. So the negative pressure set up during ventilation will also suck blood back into the thoracic cavity, using the same mechanism essentially that it uses to suck air into the thoracic cavity during inspiration. So we've talked about the effect of the valves. We've talked about blood velocity. We've talked about respiratory pressure changes during ventilation. Now, this still doesn't answer the question as to how the blood moves from there to there and from there to there in the first place. I can see that when it gets to there, the valve is going to stop it going back again. But how did it get up there in the first place? Well, the answer is that the veins are physically squashed as a result of the movement of adjacent structures. The veins are squashed. So you see if you can compress the vein, if you're going to squash the vein down, we squash this vein down. If I squash that, can you see it's going to increase the pressure in here if I'm able to squeeze that? If I increase the pressure in there, that will automatically tend to shut that valve and automatically open that valve. It's important to remember that the valves are only passive structures. The valves are not moved by active muscular movement, they just go with the pressure change. So I need some way of increasing the pressure in this vein to allow the valves to do their job. Now there's some veins which are inside muscles. These are called deep veins, deep inside the muscles of the leg. So these veins are actually inside muscles. And when the muscle contracts, what does a muscle do when it contracts? Well, of course, it gets shorter. So this muscle contracts and gets shorter. That means if the muscle's getting shorter, it's getting fatter. And when the muscle gets fatter, it's going to, when it contracts and gets fatter, it's going to press on this vein. So pressure changes caused by movement of adjacent muscles is one of the major mechanisms of venous return that in itself depends on the valves. So let's call this movement of adjacent structures. Primarily the muscles. So when the muscle contracts, compresses the vein, and the blood goes up. This works remarkably effectively in the leg. In the lower leg, for example, when you move your ankle and compress the calf muscle, the muscles compress the vein so effectively, the blood absolutely swooshes back up the leg. This is called the calf pump mechanism. The calf pump mechanism. Now I think I'll mention one more thing in this section, in this part. If that's a vein here with its valves in it, now veins and arteries tend to lie together in the body. Nerves often go in the same rough anatomical location as well. But there's an artery, and the artery is adjacent, as we've said, adjacent structures, is adjacent to the vein. Now if you find a blood vessel, if you want to know it's an artery, what do? Well, you palpate it, you can feel it pulsating. Arteries pulsate, of course, as the blood goes through them. So I think you can see if this artery here is pulsating, and it's adjacent to the vein, then the pulsation of the artery is going to compress this vein somewhat. So if that artery compresses this part of the vein, increases the pressure of the blood in that part of the vein, that will tend to close the valves below while opening the valves above, and the blood will tend to start flowing back towards the heart. There's a little bit of basic physiology there. Let's think about some clinical application of this. Well, one thing we want to do is to keep the circulation going. If people sit for too long in one place, the blood can actually start clotting in the veins. You can get a deep venous thrombosis. So it's important to keep the circulation going. This is especially true in patients on bed rest, for example. So one thing we tell them to do is to move their ankles and to move their joints as much as they can. So just lying in bed, moving the ankles can help quite a lot to increase venous return because they'll stimulate the calf pump, and that will keep the venous circulation going. What else could you advise a patient who was on bed rest to do to increase venous return? Well, we could also encourage periodic deep breathing to compress the abdomen and to reduce the pressure in the thoracic cavity to increase venous return. Let's think a little further about this idea of venous return. And what I want to do now is look at the different types of veins that the blood returns from the periphery to the heart in or via these veins. Now if you look at the back of your hand, you can see plenty of veins there, superficial veins, and in your arm you've probably taken blood from them. The superficial veins near the surface of the body, especially so in the arms and in the legs. And this is actually a set of veins. These veins are called superficial veins, veins which lie near the surface. In the leg, for example, there's some classic ones. This one here is the great saphenous vein, going most of the way up the leg actually. Starting off down, that collects blood from the foot and going all the way up here. very large superficial vein. Another one is called the short venous. Goes up here like this. And if you look for these veins, you can normally see them and palpate them, especially if you've got a tourniquet effect on the limb. So there's a whole system of, there's other ones as well as that obviously. You've got a whole system of superficial veins. But as well as that, you've got veins that are deep in the muscle. But let's draw a picture now. Here's a superficial vein coming up from the foot or somewhere like that. And of course it's got valves in it to prevent backflow of blood. So the blood can come back up. The blood can come back up here, and these valves will prevent backflow. Now the superficial veins are relatively low pressure veins. It's a relatively low pressure system. Well, having said that, if you're standing, the hydrostatic pressure can build up. But we describe the superficial veins as a low pressure system of veins. Now actually inside the muscles we have another set of veins. These veins are deep inside the leg, so we call them the deep veins. If you've ever been in theatre and seen an amputation, you see this. Just under the skin, the surgeon needs to clip off some veins, and as he goes through the muscle, there's other veins that need clipped off. So the deep veins are deep, they're inside the muscle. So here's a deep vein. And again, because we're going back towards the centre of the body, this will contain valves to prevent backflow of blood. And the key thing about this deep vein is it is inside a muscle. So here's a muscle. And muscle, you remember, is bounded by muscle fascia, tough tissue that the muscle is compartmentalised in. So there's superficial veins carrying blood back, there's deep veins carrying blood back. Now because the deep veins are inside muscles, and the muscles can contract and squash the vein, now that is a very powerful process. Muscle contraction is a very powerful process. And it squashes the veins quite emphatically, the veins get very squashed. The valves, of course, prevent the blood flowing backwards, so the blood goes back towards the centre of the body. And because they're in the muscles, we describe these as a high pressure system. The venous blood pressure generated by the pumping calf, for example, is fairly high pressure. So we have the superficial veins, which are low pressure. We have the deep veins, which are high pressure, the high pressure system. But there's a third category of vein as well. Some people call these communicator veins. Some people call them perforating veins. And what they do is they connect up the two systems. I hope you're drawing this diagram with me, because it won't make sense later if you don't draw the diagram. So the superficial vein with the valves, more valves further up of course, the vein does carry on. And the deep vein with its valves. Now, what we need is a method of stopping the blood from the high pressure veins going backwards into the low pressure veins. So in other words, we need a valves in these veins that prevent the backflow of blood. So the valves here will go in this direction. In other words, the valves in the perforating veins will allow blood to